You're broken down and tired of living life on the merry-go-round, and you can't find a fighter, but I see it in you, so we gon' walk it out. Move mountains, we gon' walk it out and move mountains. And I'll rise up, I'll rise like the day. I'll rise up, I'll rise unafraid. I'll rise up, and I'll do it 1,000 times again. And I'll rise up, I like the waves. I'll rise up, in spite of the ache. I'll rise up, and I'll do it 1,000 times again. With you, with you, with you, with you. When the silence isn't quiet, and it feels like it's getting hard to breathe, and I know you feel like dying, but I promise we'll take the world to its feet. Move mountains, bring it to its feet. Move mountains, and I'll rise up, I'll rise like the day. I'll rise up, I'll rise unafraid. I'll rise up, and I'll do it 1,000 times again. With you, with you, all we need is hope, and for that we have each other, and for that we have each other. And we will rise, we will rise, we will rise. Oh, we'll rise. I'll rise up, rise like the day. I'll rise up, in spite of the ache. I will rise 1,000 times again. And we'll rise up, I like the waves. We'll rise up, in spite of the ache. We'll rise up, and we'll do it 1,000 times again. You, you're broken down and tired of living life on the merry-go-round, and you can't find a fighter, but I see it in you, so we gon' walk it out. Move mountains, we gon' walk it out and move mountains. And I'll rise up, I'll rise like the day. I'll rise up, I'll rise unafraid. I'll rise up, and I'll do it 1,000 times again. The silence isn't quiet, and it feels like it's getting hard to breathe. And I know you feel like dying, but I promise we'll take the world to its feet. Move mountains, bring it to its feet.
Good evening and welcome to the Seacoast Women's Giving Circle Learn Forum, coming to you live from 3S Art Space in Portsmouth, New Hampshire. I'm Heidi Hansen, and together with Karen Dawson, we are the co-chairs of the Board of Directors of the Giving Circle. So wasn't that a really inspiring collection of photos you just saw? You saw women who were really thriving and surviving in the face of the pandemic. You saw essential workers and business owners and mothers and students and volunteers all really rising up to meet the challenges of these unprecedented times. We think those photos really represent the power of women and the important impact they have in our community. So tonight officially kicks off our 15th cycle of collective giving. Over the past 14 years, thanks to our generous, engaged members, all of you out there watching, we've identified 15 important topics and provided over $800,000 in grants to local nonprofit organizations.
Yes, that's right, Heidi. We have funded some really pressing needs here in the Seacoast community. Our topic this year is strengthening resilient communities during a pandemic. This is, of course, a timely and compelling topic, given world events that touch all of us in many ways, but affect many most vulnerable among us in ways we might not even imagine or understand. Our hearts go out to those of you who have lost loved ones or are struggling with some of the issues we'll be discussing here tonight. As has been our custom, we begin our giving cycle by exploring our chosen topic and then inviting local experts to fill in the gaps in our learning and to provide some insight into how the Giving Circle can have the most meaningful impact. That's why we're here tonight, to learn, and to take what we learned to the next step of our process, which is to develop a request for proposals that we will then share with local nonprofits who can apply for grants for this year's collective gift.
In December, local nonprofits will receive instructions about how to apply for one of our Giving Circle grants. And by April, the finalists will receive money, who will receive monies from our grant, our collective grants rather, will be notified. And speaking of our collective gift, we hope our members out there watching and any guests who might be tuning in for the first time to the Giving Circle, you might be interested in giving a one-time donation. We hope you'll all go over to our website and make a donation this evening. That website is seacoastwomengive.org. And your gift is going to be managed in-house because the Giving Circle is now a 501c3 nonprofit organization. However, we're still a 100% volunteer organization, which means 100% of every dollar that you donate will go directly to the nonprofit organizations that we fund.
Throughout the cycle, we also offer service opportunities for our members, organized by our ACT committee. Already this year, we've helped at the homeless shelter with garden cleanup, and we'll be working with Gather to help distribute food supplies around the Thanksgiving holiday. We'd like to thank our sponsors and community partners who have supported the mission of the Giving Circle. A heartfelt thank you to Piscataqua Savings Bank, Foundation for Seacoast Health, and 3S Art Space for generously hosting us here this evening and making it possible for us to stream this production live to all of you.
If you're logged into YouTube tonight as a user, you'll be able to ask questions in the chat function of the YouTube channel. So feel free to send your questions throughout the program tonight. We will be using the last 10 minutes to answer those questions with our guests here to speak tonight.
And it's now my pleasure to turn over the evening program to Jody Walensky-Hill, who will be our MC tonight. Jody is a member of our Learn Committee. She and her committee members have been immersed in our topic for the better part of the past 2.5 months. A huge thank you to the Learn Committee members, Joanne Knight, Sue Spalding, Ashley Weir, Cindy Knapp, Erica Taylor, Linda Daly, Margot Schmolka, and Sue Durkin. Please give a warm welcome now to Jody.
Thank you, Karen. Thank you, Heidi. And thank you to all of you for joining us for our first ever online Learn Forum. I am honored to be serving on the board of the Seacoast Women's Giving Circle. For decades, I led nonprofit organizations, and I now work as a consultant growing the impact of organizations. I have led organizations funded by giving circles, consulted to giving circles, and belonged to giving circles. I am a big believer in the power of collective giving. Because our topic, strengthening resilient communities during a pandemic, is so complex, I want to provide a brief overview of what the Learn Committee learned about the impacts of the pandemic and what informed our program for this evening. First, even though COVID illness numbers are relatively low in our region, the downstream health, economic, and stress-related impacts of the pandemic are broad. So many are impacted by schools and child care programs closing. So many are impacted by businesses closing and downsizing, and by job loss. And so many are experiencing the fallout of so much stress. The Learn Committee also learned that while the impacts of the pandemic are felt by almost all of us, that there are clear inequities in who is more vulnerable to the illness and who is more vulnerable to the secondary impacts of the pandemic. We hope that tonight you learn about the many challenges growing out of the pandemic. We also hope that you learn about how local nonprofit organizations have stepped up, have pivoted to meet increased needs, and to do this sometimes in new ways. On the screen, you'll see a graph. The state of New Hampshire, Maine as well, has done an impressive job posting local data. This helps us to understand the impacts being felt closer to home. The chart on the screen shows the steady and rapid increase of New Hampshire households receiving public assistance of some kind since the pandemic started. Tens of thousands of our neighbors have joined the ranks of those receiving and needing state support for rental and housing assistance, for food, for health care, for child care, for unemployment. As a giving circle made up of women, we want to take particular note of the impact of the pandemic on women. While more men than women sadly die from COVID, there is mounting documentation of women bearing the burden of pandemic-related job loss, illustrated on the slide, school closings, and other downstream impacts of the pandemic. We are very fortunate to have Kirsten Dursey as our first speaker tonight. Kirsten will expand on this introduction of inequities of the pandemic and impacts on women. With a master's in public health, Kirsten works as an epidemiologist and evaluator for the New Hampshire Department of Health and Human Services. As you can see from Kirsten's title on the slide, she wears many hats, all that have her at the epicenter of the pandemic in New Hampshire. Kirsten is going to give us a short course on what has contributed to the inequities of the pandemic and what the short and long-term impacts are of these inequities.
Good morning, everyone. I am Kirsten Dursey, and I work at the Division of Public Health Services for the state of New Hampshire. I'm going to talk a little bit about the concept of equity and health equity and racial equity in particular, and COVID-19 and the pandemic here in New Hampshire. So when we talk about health equity, what we really mean is that everyone has a fair and a just opportunity to be as healthy as possible. And so I'm sure that you are all aware, you're absorbing the news, you're recognizing what's happening around you. And these are some of the very early on, March, April, May headlines that were popping up in national news media sources, really identifying that we were beginning to see pretty extensive racial disparities in COVID-19 as the COVID-19 data began to be released. And of course, we began to wonder, would we see the same in New Hampshire? And I think for those of us who've worked in the field of public health for long enough, or those of us who've worked in the field of health equity and racial equity, we knew that in fact, we definitely would. And in fact, we have. So, just to kind of lay some context, when we think about the concept of equity, if we really had equitable systems, systems that did not widen or further disparities, then we would see across different groups very similar rates of access and utilization and health outcomes. So if we were talking about access to healthcare systems, utilization of healthcare systems, or health outcomes, we would see very similar results. And that is not what we're seeing now. Now, it's not what we're seeing for COVID. It's not really what we see for almost any other health issue. This is a really important graphic, and one that I reference a lot. This is actually from the Vermont State Health Improvement Plan, but it was adapted from the Bay Area Regional Health Inequities Initiative in California. And we use it as well. And it really is a graph that sort of outlays what the distinction is between what we talk about the upstream drivers and the downstream drivers for health outcomes. And so on the right side of this screen, you'll see things like risk behavior, disease and injury, and ultimately mortality, and I would add severe morbidity. But you see things like tobacco use, exposure to violence, different risk behaviors and different disease outcomes. Like we have here listed infectious disease, but you could certainly put COVID-19 in that category as well. If you move a little further to the left, you begin to see some identification of what we often call the social determinants of health. Things like living conditions, how we live, work, play, pray. So what does the green space around us look like? Do we have access to transportation, housing, safe and secure housing? Is there food security? Do we have exposure to extreme violence? And are we employed? Is there enough income to sustain our lives in a safe and secure manner? And then even further to the left, we get into what we are really deeming our high upstream drivers of inequities. So things like racism, classism, gender discrimination, sexual orientation discrimination, and health and wealth inequalities, wealth inequalities. And these really are the drivers that sort of lead to everything further downstream not being equitable. So when we talk about our world in public health, we talk about our world in healthcare, our world in social services, our community services, we spend a considerable amount of time in the downstream world. We address disease and injury directly. We talk significantly about risk behaviors. And of course, we're very conscious and aware of severe morbidity and mortality. We talk a little bit less, but still some about living conditions and social determinants of health, the things that are within our scope of control or we think are within our scope of control. And I think you have some speakers today who will address some of those issues. We talk the least amount about where the most extreme driver sits, which is in our wide historical, social, and institutional and systemic inequities. So my reason for showing this graphic is to say that we're putting our hands in a lot of different places, and we're spreading resources across a lot of different places, and all of them are important. We have to address the downstream issues. People are suffering and they're dying and they're sick and they're without care, and we have to address that downstream. But if we address only downstream without addressing the upstream drivers, we will continuously be in the downstream, pulling people out of the way of harm, and continuing to see these inequities widen. So I always suggest that we need a multi-pronged approach. We need to be addressing systemic and institutional inequities upstream, while at the same time addressing social determinants of health midstream, and of course our downstream drivers as well. So I think the one thing that has become increasingly clear, and for many of us was clear from the beginning, but has become part of the public discourse, is that the pandemic really has unmasked the longstanding underlying structural and systemic inequities in our system. So, I always talk about the pandemic a little bit like a tsunami. It came in and it just continued to roll in, and along the way it picked up every structural and systemic inequity that existed and pulled it further inward. And we've seen those inequities continue to widen. I'm going to leave you with this, which is, as of November 10th, 2020, what we do know is that racial and ethnic minorities in New Hampshire are experiencing 2.8 times the rate of COVID-19 infection, 4.4 times the rate of hospitalization, and 1.5 times the mortality rate compared to white New Hampshire residents. And we do adjust for differences in age distribution to make that, before we draw that conclusion. But basically what we're seeing is that our inequities related to COVID-19 that run along racial and ethnic lines are very much in line with the national inequities. So, some of the other things that I think beyond the sort of significant impact of COVID-19, particularly on communities of color, for immediate health and long-term health, there are some other long-term impacts that we need to think about whenever we're facing a public health crisis, like a pandemic. And this is a pandemic unlike really any we've seen before. And some of those that will continue to be concerning to us and maybe concerning to you as you think about what's impacting your communities, your local communities, and where resources could be put. We begin to be concerned anytime we have a significant amount of resources pulled to one thing, that we will begin to have emerging and re-emerging health conditions become greater issues. So, some of this is really, a lot of it actually driven by the fact that people are not necessarily attending to current other health conditions, that they're isolating, they're not seeing their doctors, they're not seeing their dentists, they're not dealing with preventative issues. So, we begin to worry about what could emerge or reemerge in the face of a pandemic. Of course, it's everywhere. Everybody's talking about it. It's critically important that this concept of quarantine and isolation is deeply tied to our behavioral health, our mental health, and this has been particularly true through the face of this pandemic. And I think it will continue to be even a more significant issue as we move into the wintertime, which is already isolating in a place like New Hampshire. And we are just moving into a more impactful and significant part of the pandemic. And so people will continue to be quarantined and isolated away from their families through the holiday season, isolated away from their workplaces and their friends. And this can be have a really detrimental impact on people's mental health. We worry significantly about food, food insecurity and housing insecurity, particularly for people who are really impacted by this economic downturn as well. We worry about education, the impact of education and its social impact of being isolated on children and families. And I think that that's deeply tied to what we're seeing as the impact, particularly on women and women-led households, but also women in two-income households who may have had to leave, either lost or had to choose to leave their employ to care for their children and deal with remote learning. And what that long-term impact on women, particularly women who are already on economically disadvantaged, is going to look like, I think is a significant long-term impact consideration that we need to be thinking about now. All in all, this is what we see, as I said, with the pandemic, is that we are just widening and will continue to widen all of the existing health inequities that have already existed. And so I'm going to end it there because I think that's probably at or maybe a little above my 10 minutes. My contact information is here on the screen. I welcome you to reach out to me, and I would be happy to talk more about either the work that we did in the report or the work that we're doing in public health to address health inequities.
Kirsten clearly has a wealth of knowledge to share. Thank you, Kirsten, for joining us virtually. Changing gears a bit. Before the pandemic hit, our local nonprofits were focused on meeting the needs of our most vulnerable populations. We will now hear from our frontline nonprofit leaders about the impact the pandemic is having on the community and on their organizations. We will hear inspiring stories about how they are meeting the increased demand for services and about some new solutions.
Hi, my name is Greg White. I'm the CEO of Lamprey Healthcare. We are what's called a federally qualified health center with locations in southeastern New Hampshire, most notably Newmarket and Raymond. As such, we are what's considered a safety net provider for the purposes of access to primary health care, primary behavioral health care, and substance use treatment services. In our capacity, it is our mission to provide care to everyone, to do so without regard to their ability to pay. We're here for everybody. Since last March, we've had to ramp ourselves down in response to the COVID pandemic. Typically, we see about 60,000 visits annually in terms of patient visits, and in an industry that's driven by volume, that equates to almost $1 million for us. So when you run an operation that's generally around break even, more or less, that kind of revenue hit, it's hard to sustain, particularly for those services that aren't typically reimbursed through that mechanism. As part of that, we've had to furlough staff, put a number of staff onto remote workforce status. We implemented telehealth. We've seen our volume go from well over 1,000 visits a week down to about 400 visits a week. And since that time, we've brought it back, almost. We've had to ramp down a number of programs in response to the pandemic, notably our transportation program. We had to suspend operations of our school-based dental program. We've had to pivot and provide testing in our parking lots. We were open throughout the pandemic to do testing, not only for our patients, but for the community, for healthcare workers, and for first responders. So we've had to think outside the box a little bit. As part of this, we've also started doing community immunizations in our parking lot, in people's cars. We're really looking forward to taking our mobile health van on the road. And with that, we'll be able to bring our immunizations, our testing, even our behavioral health and medical health services out into the community where patients are. So most notably, I think, we feel there's an opportunity there. I think some of our challenges may be that our healthcare reimbursement system is not caught up to this modality. Certainly, we understand better now that we have an opportunity to get out into the community to deliver our services outside of our four walls. And I think we've proven we can do that.
Hi, my name is Jay Kuchar. I'm the president and CEO of Seacoast Mental Health Center with offices in Portsmouth and Exeter, New Hampshire. The mission of our center is to provide a broad, comprehensive array of high quality, effective, and accessible mental health services for residents in the eastern half of Rockingham County. Throughout the COVID-19 pandemic, we have remained open, though many of our services have transitioned to telehealth platforms. Some of our services required ongoing in-person provision. This included our 24/7 staffed group home in Greenland, some of our psychiatric medication services, and some of our community-based supports, as well as our 24/7 emergency services department. Through the months of March to October 2020, we saw an increase compared to the same time period last year of 18.5% in the number of services provided. This resulted in more than 13,000 additional services provided to individuals and families during this time. We have seen demand for service increase across all of our programs, and we do not anticipate that it will decrease anytime soon. People are facing issues of anxiety and social isolation, in addition to other serious and/or chronic mental health and substance use disorder issues that are faced by individuals in our community. We have been able to use telehealth to decrease barriers of care, eliminating transportation issues and providing, in some cases, direct admission access to psychiatric inpatient beds without requiring a stop at the local emergency department. This has decreased exposure risk to COVID and has also decreased the risk of an individual needing to stay in the emergency departments for several days or weeks at a time, waiting for a psychiatric bed to become available, if we are able to support them while staying at home and waiting for that bed to become available to them. We don't see this changing anytime in the near future with the risks of COVID and the increased numbers in our community. We will continue to provide both telehealth and in-person services as appropriate, limiting the capacity of our buildings as recommended by the state's public health department and the CDC. We appreciate the work that the Seacoast Women's Giving Circle does to support the many nonprofit service providers in our region, and we'd be happy to talk about more of our services at an in-depth level at any time. Thank you so much.
Hi, I'm Kathy Beebe, and I'm the Executive Director at Haven. The mission of Haven is to prevent domestic and sexual violence and stalking, and to help women, men, children, and families to heal from abuse and rebuild their lives. Haven has been really busy even before the pandemic hit. We serve all of Rockingham and Strafford counties and see thousands of people each year accessing services as well as participating in our school-based kindergarten through 12th grade prevention education programs. Since the pandemic, it's been a really challenging time for the organization in terms of survivors being at greater risk due to the isolation of COVID-19. Where before they may have had respite from abusers by going to work, going to school, they've been stuck in their houses, and we've seen the impact that it's having on those that are in abusive relationships or are being abused at home. What we've done to address all of that is to really make sure that we were changing all of our services in a way that we could continue to be accessible 24 hours a day. We implemented a chat feature to let folks know that they could type their way to getting help, to reach out as if they were working on their computers, so that if they were being watched and unable to pick up the phone and call us, they're still able to reach out. We've also created an alternative to our shelter so that we could increase our capacity. What we've been seeing is that more and more people, the abuse is escalating to the point where they need safe shelter and they are in imminent danger. We've also tried to expand on our housing work though, because we also know that there's people leaving abuse that aren't in imminent danger but still need a safe place to live and to have as their permanent homes. So we work with them and landlords in the community to help find housing and help provide support until they're on their way to safety and self-sufficiency. The other thing that we've been doing is try to get creative with our prevention education, with schools doing all different things, some being fully remote, some being a little bit in person. We're still not able to go into the classrooms, so we've had to figure out ways that we could virtually Zoom into the classrooms for the kids that are at school. But also for the kids that are at home, where home might not be a safe place, how can we creatively get messages and awareness and help to those children that need it the most? So at Haven, we've been doing a lot. We've seen increases in the need based on more people reaching forward with more escalated violence and complex situations. We've seen some funding that's been dedicated to COVID relief that's allowed us to provide some of that alternative shelter and deal with those increased costs, but we've also seen the challenges around unrestricted revenue and the need for fundraising and support that will allow us to provide all of the services both during the pandemic and after the pandemic. We've seen tremendous community support though, and it's been great to see so many in the community rally with us, and we're thankful to the Seacoast Women's Giving Circle for all that you do to help the community to be a safer place to be. Thank you.
Thank you so much to Greg and to Jay and to Kathy. What wonderful organization leadership we have in our region. Continuing that theme, it is my distinct pleasure to introduce Martha Stone, the Executive Director of Crossroads House. Crossroads House is a 100-plus bed homeless shelter and so much more. Martha joined the staff of Crossroads in 2004 as the development director, successfully executed a $5 million campaign to build a new shelter, and was named executive director in 2013. Martha Stone.
Thank you, Jody. I appreciate the opportunity to be here this evening. So as you heard, my name is Martha Stone. I'm the Executive Director of Crossroads House, and we are a shelter providing emergency services for men, women, and families in the Seacoast region. We actually provide services to people all throughout eastern Rockingham County, Stratford County, and even up into southern York, Maine County. So even before the pandemic hit, Crossroads House has been an organization that's open 24/7, 365. And since that day in March, when we really all began to understand the severity of the pandemic, Crossroads House has remained open and operational throughout this entire time. We provide safe shelter for people, 3 meals a day, and all of the basic necessities that people need when they come and stay with us. One of the most critical parts of our work is connecting the people who stay with us with a case manager who meets people where they're at and figures out what do they need in addition to housing. And together they create a roadmap to be able to figure out how they can move from homelessness back into permanent housing. We certainly don't do our work alone, and we rely on the collaborative relationships that we have with so many wonderful other partner agencies in the community who help us deliver those supportive services to people. Examples include medical care, dental care, substance use treatment, behavioral health counseling, and more. So last year at Crossroads House, we served 364 people, including 62 children from 27 families. And that includes over 37,000 bed nights of shelter. What that means is every time someone lays their head on a pillow, we count that as a bed night. And so demand remains very high for us. We also measure how long people are staying at our shelter, and last year our length of stay was 103 nights. We're really proud of our success rate, even during a pandemic, which is pretty remarkable. For people who stayed with us for 90 days or more, 87% of individuals and 92% of our families successfully moved from homelessness into permanent housing. So we've certainly had a number of impacts because of the pandemic, and I want to share some of those with you this evening. When the pandemic hit in March, we had about 120 people staying at our shelter, and as you heard from the introduction, our normal amount is around 100 people. So we were above our normal amount, which is typical in a winter month. But we had to figure out exactly how we were going to move forward in a time where the way we had traditionally delivered shelter was no longer going to be acceptable. Just to give you an idea, demand, people always ask how busy we are. We currently have approximately 125 people on our waiting list. So one of the greatest challenges, if you think about it, when the governor issued a stay-at-home order, if someone was unsheltered, living outside or living in their car, or even living in a congregate shelter like Crossroads House, you could not really abide by the governor's stay-at-home order. And we recognized that, and our residents did as well. So it was a very tense time when the pandemic first broke out. One of the other effects was that we had to cancel our in-person gala, which we rely on as a fundraiser to raise $400,000, so that was pretty significant for us as an agency as well. Additional impacts included the fact that the CDC guideline recommends certain spacing of beds in a homeless shelter, and as you can see from this photo, we were nowhere close to being able to meet that. Our bunk beds were spaced maybe 2 to 3 feet apart, so we knew that we were going to have to make a change. Additionally, the people that we serve often lack access to medical care, and so when they arrive at Crossroads House, their medical conditions can be significant, and we knew that we were serving some people who would be very vulnerable to COVID-19 and could potentially suffer some complications if they were to test positive. So we have worked extremely hard to protect people, and I am really proud to say that to date we have not had a single case, so knock on wood for that. Additional responses include the fact that all those supportive services that I mentioned, we really wanted to keep people connected to their providers, and so we supported people in using telehealth and had some technology supports to allow that. One of the most significant things that we have done is to implement what we call a decompression plan. We basically needed to spread people out. So we took some of the people who were most vulnerable and those who were still working at jobs outside of the shelter and moved them to a local motel so that we could literally put more physical space between people at our shelter. We supported all the students at the shelter with remote learning needs. We had to suspend people all our wonderful volunteers who come in, they used to come in 7 days a week and cook and serve dinner. We had to suspend those operations. And like all businesses around the Seacoast, we enhanced our cleaning protocols, and we had hand washing sinks put in. We are doing screening of all of our staff and all of our residents, things that everyone is getting pretty used to everywhere they go. There were also a number of funding changes and challenges that we faced. As I mentioned, we had to cancel our in-person fundraiser, which was a challenge for us to shift to a virtual model of that. We also, on a positive note, we have benefited from many COVID-related funding streams, but the money that we have received is to offset our increased expenses related to our response to the pandemic. So, for example, the hotel plan that we have, the hazard pay that we are paying to our staff members, these things are very expensive, and so these types of funding sources are helping us offset those. We're also very fortunate to be doing some shelter modifications to make the shelter a safer place. So what are our remaining challenges? Certainly gearing up for the winter is something we face every year. When it gets cold in New England, the demand for shelter increases, and so we've been gearing up and working with our partners to figure out how we can best meet the needs. We certainly are concerned, like everyone, about the rising number of cases in our community and community spread. We're working hard to implement some surveillance testing, which we have not to date had, so we really want to be able to continue to protect people and implement a protocol around testing. And also we're looking ahead to 2021 and how we can plan for and execute a virtual fundraiser, because we anticipate we'll need to do that again this coming year. So even before the pandemic, one of the major challenges that we faced, once we got people into our shelter, we do a really great job in supporting them, but helping them transition out to permanent housing has been really difficult. There are a number of factors for that. We have a huge shortage or an extreme shortage of affordable housing in our community. We also have a less than 1% vacancy rate in the rental market, which makes it really challenging. We also are very carefully watching the expiration of an eviction moratorium for people who are currently protected from being evicted. When that ends, there could be a surge or a spike in those who are experiencing homelessness. There are a number of ways that we encourage people to help for those who are interested. While our volunteers cannot come on site and cook in our kitchen, you can cook at home and deliver a meal. We have on our website a wish list of items that we always need to help us, items to help our residents who are staying with us. Financial donations, of course, are always welcome and needed. We do have an Amazon wish list as well. People can click through and have things shipped directly to us. And this opportunity tonight is such a fabulous, we're really grateful to have this opportunity to share the story of our work and how people can get involved. So we would encourage people to monitor social media and share this recording when it's available to raise awareness. So when I think about resiliency, I really appreciated the topic tonight, and the things that come to mind to me are the dedication of our staff who have showed up every single day to continue to deliver services to a very vulnerable population, the generosity of our donors who literally make our work possible. Without them, we could not deliver the shelter that we do, and the perseverance of our residents. Since the start of the pandemic, we have helped over 70 people move out of the shelter and back into permanent housing, which is pretty remarkable given some of the challenges that I just reviewed with you. When that happens, we now invite people when they sign their lease or get their keys to come to our front desk and ring a brass bell, not only to celebrate their success at the shelter and all of their hard work, but also to offer some inspiration to those who are still there. And it's really, when I hear that bell ringing and I hear the cheering and applause, it really, for me, brings home the meaning of our work and really how transformational it is for the people that we serve. So I just want to take this opportunity to thank the Seacoast Women's Giving Circle. We have a very long history with the organization, lots of hands-on help. We literally could not do our work without the support of groups like the Seacoast Women's Giving Circle, and I really appreciate this opportunity to speak with you tonight. Thank you.
Thank you, Martha. You inspire all of us. I want to remind everyone that if you are logged into YouTube, you can enter your questions in the chat box and we will try our best to answer them. As we know all too well, the pandemic is impacting so many aspects of our lives. The arts and how artists are impacted, education, any of you with school-aged children are experts on this. Food insecurity, often an invisible struggle for individuals and families. To learn more about these issues, we will now hear briefly from 4 exemplary local leaders.
Hi, I'm Beth Faulkner, Executive Director at 3S Art Space, and we are thrilled to once again host your Learn event at the Seacoast Women's Giving Circle. Everything we do at 3S Art Space is guided by our vision, and that vision is that by creating a space for the intersection of arts and contemporary issues, we find a way to encourage each other to stay curious, foster empathy, and really fuel creativity. Like all arts organizations, 3S Art Space has been greatly affected by the COVID-19 pandemic. We shut the doors to our indoor performance space for ticketed events and for private rentals in early March. We have not been able to reopen that space. Unlike some other theaters, our max capacity pre-COVID was based on a standing capacity. Many of our music events were presented standing, club style. COVID-19 not only requires that we socially distance, but that we stay seated. We can't really manage crowds walking around. So for us, that means that our capacity has really reduced from 400 standing to about 50 seated. And that requires a lot of reimagining to make that work with our business model. However, I do want to just say that actually ticket sales, concession sales, and private event rental revenue, we've lost about $700,000 to date in those 3 lines alone. That doesn't even begin to discuss what we think may or may not happen with philanthropy, which is more important now than ever. So again, that number, 700,000, it's daunting, but there have been many silver lining opportunities. We were fortunate to receive PPP funding and some NERF funding. We expanded the profile of our Loading Dock concert series, and we sold out 24 summer events. Our gallery has stayed open to the public, and we are offering 3D tours online for those who are not yet ready to come inside, and we really do understand that. So we've been seeing, again, a lot of these opportunities to learn that we think will carry forward, those hybrid events where you can visit us live and live streamed, where we can figure out a way to move forward together.
Hi, I'm Superintendent of Schools Steve Zadrovic.
And I'm Assistant Superintendent George Shea.
Welcome to this week's edition of Q&A with Zadrovic and Shea. This week we're featuring one of our favorite organizations, the Seacoast Women's Giving Circle.
Oh, they're good.
Yeah, they'd like to ask us some questions about the impact of COVID. So let's start for the first one here. What is the mission of your organization?
2 minutes for the whole thing, right? To create confident learners who can be successful and thrive in the 21st century.
Fair enough.
Has there been a change in demand for your services, they ask?
Well, no, we're still trying to educate all students in the city. We have found that in our hybrid model where some students have to access learning remotely, that's also puts some pressure on parents, and we're trying to work with them to help alleviate that. And part of that is by finding space, like at the senior center we're doing, to have students there to access remote learning. How about, has there been a change in funding?
No change in funding from the municipal side, but our expenses have obviously risen as we've had to do more technology for students, transportation, personal protective equipment, and such. So, has there been a change in the delivery of services?
Well, I mean, our model does have teachers teaching remotely, teachers teaching in person. So how we do our instruction has changed, and it's a lot of work for teachers, exhausting work, but they're doing a great job. And leads us into what is working.
I think our work towards giving more to the kids who need more, that equity piece of really targeting students who need the most and giving them as many resources as possible to keep them on pace. What's not working, Steve, and remaining a challenge?
All right, well, getting more students in more often. We are definitely challenged by space and staffing to have students, all students in every day, and that's just our current reality in this pandemic. How about what do you hope to do in the next 6 months to help?
I think keeping that social contract to keep infection rates low and keep our schools open. And I think really targeting, being proactive about targeting those students with social emotional issues who may be falling behind and making sure they have those connections and support.
And you're going to develop the vaccine, right?
And that vaccine, but that's an after hours. Can you give a client story of the impact of COVID-19?
Well, as I was just talking about with the senior center, getting these kids together to do the remote learning, one thing we realized and discovered is that just being in the same room gives a little bit of that social connection. In fact, when we tried to move some of them out, they really didn't want to. They wanted to stay together, even if they were just accessing remote learning. So we know that social connection is really important.
Great. Thank you so much.
All right, have a great day.
Hey everyone, I'm Deb Anthony and I'm the ED at Gather. Welcome to Gather. This is a really short video to try and tell you a little bit about who we are and what we do and how we've responded to COVID in the last year. And so I hope that some of this will be informative to you, and I hope it will give you some pause to think about the people in our community. We've grown significantly in the last few years, and this year we've had incredible surge of numbers of people and need given COVID. So I wanted to share that with you so you'd know, but also so that you would know that how fragile some of the lives are for people, because we've been seeing people that typically we might not see. Last year when we did, for example, mobile markets is something we do, one with our Meals for Kids program, but separately we do mobile markets for families, seniors, anyone in the community. They may need to come and get food, but don't want to come to our pantry market. So those mobile markets, last year we were doing maybe 300. And this year we're doing over 1,500 a month. 1,500 people a month are attending our mobile markets. We started Meals for Kids when we normally wouldn't have. We started in March and we have not stopped doing Meals for Kids every week for the entire year so far, and we fully expect that we'll be doing Meals for Kids through December. We have over 200 volunteers a month that are necessary, a month, to make this work. And I want to thank people who do that for us, because we know that you could stay home and you could be safer and you're coming out. Last year we were doing 100,000 pounds of food a month out our door. Now we're doing 200,000 pounds of food a month out our doors. This is not going away. This is going to continue for a serious amount of time, at least through the winter. And we're really hopeful that people will continue to consider these basic needs as we go through the winter months, when things like heat and rent start to really impact some of our members. Hunger isn't here just because of the pandemic. Hunger is here all the time. And so I hope that when you think about where you'll help support in our community and where the need is in our community, you'll consider Gather, because we have been meeting an essential need long before the pandemic, and we're just doing it even bigger and even stronger during this pandemic to ensure that our entire community is safe and can go home and have a meal. Thank you.
We at the Giving Circle are so grateful to be able to share with you the voices of so many incredible community leaders who do such great work on the front lines. Amazing. It is fitting that our last speaker this evening is Lauren Wool. Lauren works with a bird's eye view of what is going on in our communities. Lauren is Senior Director of Community Impact at the United Way of the Greater Seacoast, where she is responsible for assessment and prioritization of regional needs in order to plan and implement all United Way grants, programs, and initiatives. She needs a bird's eye view. Lauren has a growing interest in diversity, equity, inclusion like all of us, and is committed to using her leadership role and voice toward increased equity in grant making and improving community conditions for all. Lauren will help us end the evening with her bird's eye view.
Thank you so much. My name is Lauren Wool, and I work at the United Way of the Greater Seacoast, and I'm really grateful for the opportunity to be with you all tonight. So the United Way of the Greater Seacoast has a geographic footprint of 47 towns. So the 8 towns that the Seacoast Women's Giving Circle focuses on are included in those 47 towns in New Hampshire and in Maine. And although those who give to United Way and volunteer for United Way live and work both in and outside of that footprint, our investments are made within that footprint. So United Way focuses on 2 foundations for better lives. The 2 buckets of our work are educational success, so helping children to enter kindergarten, ready to learn, and then stay in school and graduate. And then also financial opportunity, which includes many investments around housing and homelessness and financial literacy. We also harness the communities working together to make sure that we can convene all sectors around the community's pressing needs. We fund and partner with effective nonprofits. We focus on pressing issues, and these are the reasons why United Way was positioned well to respond to the pandemic. The first thing that we did early on was launch the COVID-19 Family Support Fund. We were able to provide financial assistance to agencies so that they could provide for their clients throughout our region. We made grants that totaled $245,000. We worked through 24 of our partner agencies, and the results were that we were able to support individuals and families in more than 4,000 households throughout our footprint. The financial assistance was focused on basic needs like rental assistance, utilities, sometimes paying minutes for a cell phone, diapers, grocery gift cards, and the like. Later on, we were also in a position to partner with Granite United Way and the Governor's Office to provide an additional $175,000 for individuals not only impacted by the pandemic, but also whose households were affected by substance use disorder. So when asked to review the impacts of COVID, I just want to share a few different categories that I think will summarize a lot of what you've heard from the other leaders in our region who have spoken to you this evening. The first is agency operations. It's obvious that agencies have lost a lot of revenue due to not being able to raise funds in all of the same ways in person as usual. Staffing levels have been difficult to maintain. It's been difficult to respond to the increased demand for programs and services. And then, as you've heard, there are lots of additional costs related to functioning effectively and safely in the pandemic. Thinking about additional protocols like the cleaning, the supplies, and the staff time it takes to keep people safe. The second category is really what are the barriers that clients face in accessing services? And I just wanted to run through that. A lot of confusion and overwhelm has occurred for our community members in terms of just being aware of programs and services. Were they eligible or not? Can they afford these services given changes in their own lives around job loss or hours or wages lost or furloughs? We know that technology and Wi-Fi access has been an issue, but it's also an issue of technology literacy. So in cases if families are supported with the equipment necessary, it doesn't necessarily mean they're able to support their children's learning. The lack of affordable housing has exacerbated the bottleneck that Martha and others have spoken about in terms of helping folks who have found themselves in homelessness to find safe, permanent housing. And then there's certainly limited capacity in our child care programs, in our after-school programs, and now, given all of the changes with space and staying safe, that shortage of slots and the increase in demand has created real challenges. Lastly, we know that there is unmet need. A lot of the agencies that have reported to United Way have said that there is unmet need. There are folks they're not able to serve. And in addition to that, it's important to note that there are many people coming to our area agencies who have never had to ask for assistance before. We know that stigma plays into whether or not individuals and families are comfortable to ask for help and access services. That's things like food pantries, family support, mental wellness, and isolation is a growing concern. It's very difficult to maintain relationships during a time when we're all separated and apart. Lastly, on this slide, I want to mention that New Hampshire's 211, the phone number that you can call with questions about any health and human services type of information or referrals, their call volume nearly doubled over 2019, and that data was collected in October. So this year isn't even over, and the call volume is that much higher. People will call 211 for 5,000 different reasons, but the top 10 reasons they call have remained the same. Homelessness, financial assistance, utility shutoffs, addiction and recovery services. So United Way's response, as I mentioned, we were able to quickly mobilize and provide some funds, but we've had to pivot and take all of our volunteer engagement opportunities, which are typically in person, and make those virtual. You can see those listed on the slide. And as we look at our long-term impact strategy, we're going to be launching a 9-month process where we do our needs assessment, we listen to the voices of the community, and we really think about an equity lens in our grant making. We want to be sure that we use the demographic data that we ask of all of our agencies to collect, and we want to be sure that even though we are all in the same storm, we are not all in the same boat. So can United Way do even better connecting our limited resources with the folks in our community who are the most vulnerable? In terms of the funding landscape, I just want to share an overview that United Way's Family Fund was very flexible. These are donor dollars given to us for 100% of the financial assistance grants going to clients in our community. The Federal CARES Act provided lots of specialized funds for things like you can see listed on this slide. However, the agencies that are doing good work in our region and throughout the state didn't all have a pathway to those CARES Act funds for a variety of reasons. There was even a nonprofit emergency relief fund, which included arts and culture, the environment, as well as health and human services. But even those funds were only given to 75% of the applicants and only cover revenue that was lost through the end of this calendar year. So we can expect that as we round the corner into 2021, agencies in our region will still be challenged by their operating costs, even given all of these supports. So we're bracing ourselves. We know that food pantries had seen lower numbers early in the pandemic, perhaps because of the public supports and benefits through SNAP and employment supports, but now those numbers are ticking back up. We know that rental assistance is available right now through the community action programs in our state, but we also know that the next relief package is very uncertain. The last point on this slide I'd like to share is that United Way is also at the table with all of the other funders in the state. And so collectively we are thinking about how to be more equitable in our grant making. And I thought it was worth mentioning because there is a task force on equity that has provided some recommendations, and that funders group is looking at all of that data. The last couple of things I'd like to walk through is the ongoing needs that we know we will be faced with moving forward. Mental health of seniors and those who are isolated, of parents and caregivers trying to juggle their own responsibilities and those of the children that they care for. We know that childcare and after-school program will continue to be important, family support programming, the stigma that I mentioned, the agencies who need operating support, the individuals who, along with rent, are likely to need fuel assistance and food and all of the uncertainty that goes with that. So lastly, I'll just walk through a couple of points about resilience. I wanted to share that when we work together, we can do more. There was a partnership between Gather and the Foundation for Seacoast Health and United Way, which helped to expand Gather's mobile markets earlier in the summer. We know that community health centers are tapping into technology to serve their clients better, those that are on women, infants, and children, those that are being served through home visiting. And we know that family resource centers are finding ways to gather families virtually, that parents a second time around, it's called PASTA, those that are finding themselves raising children are finding ways, even virtually, to get together. So I will leave you by saying that when we work together, we know that we can do more together than any of us can do alone. We recognize the work that all of you do and the money that you raise as being so important. While donors and volunteers may grow weary of giving, the pandemic is lasting on. And I think the work that you do makes a big difference. Thank you so much.
Thank you so much, Lauren, for the bird's eye view and for sharing so much with us. If you would grab that mic and have a seat. Perfect. We have a few questions that we're going to ask Martha and Lauren, and they've been kind enough to not only speak, but have questions tossed at them. Martha, one of the things that struck us as we've gone through our learn process is schools being closed and parents trying to educate children at home. Are there any stories you can share about parents handling educating their children in the shelter?
That's a great question, and definitely it's a challenge. A story I'll share is, it's a great one because they actually moved out 2 weeks ago, but I had a single mother with 5 teenagers living at the shelter in very small quarters. One of her children actually goes to a boarding school, so she had 4 teenagers all in very small spaces, all trying to remote learn. So you have technology challenges, which we tried to support them. Some of the kids wanted to be on phones, others wanted to be on laptops. We work collaboratively. You know, Lauren made a great point. None of us do this work alone, so it's the collaboration. So our case managers work very closely with the school departments to make sure that the kids' needs are met in terms of technology. We were able to support some as well. You know, I'm sitting in my office worrying if there's enough bandwidth, right, for all this remote learning. There's just all these new challenges that we had to face. So we continue to make sure that kids' needs are met, and but it is not easy. That particular mom was not able to work, and she wanted to, but she couldn't because she had kids at home who were remote learning, which is no different than other people who are housed, but she was trying to work her way out of homelessness.
It sounds very different and much more challenging. It's been on our minds a lot. And as you said, everybody working together produces much greater results, much better results. Lauren, specifically as you think about that and think about organizations or collectives of organizations, what successful investments have you seen organizations make in their own capabilities to navigate the pandemic and continue to provide services?
So organizations funded by United Way have all made Herculean pivots. I think they're all doing a really beautiful job of rethinking the programs and services that they provide and trying to do more with less, which I think all of the nonprofits have become expert at. As I mentioned, finding ways to convene their clients who are used to being together in a more virtual format, and sharing best practices. I have the opportunity to hear from groups of nonprofits who are very willing to share what has worked and what hasn't. I mentioned a family resource center that happens to be out of this greater Seacoast area, but they've done some really beautiful work. So we're connecting the dots between their successes and the family resource programs here in this part of the footprint.
Great. That staying connected piece is so important. We have a question about fundraising, which I know is near and dear to both of you, as well as to all of us. How can organizations engage with their donors best during this time when agencies are tired, workers are tired, and donors may be tired?
Maybe we can both answer this a little bit. So, you know, we've always found pre-pandemic and now during a pandemic that it's really important for us to communicate with our donors, people who are interested in our work. So we have tried to share with people, whether it's on social media or sending out newsletters, about our work and really how a donor's dollar makes an impact. I mean, I think that's the most important thing. People are sitting at home, they want to know how they can help, and they want to know what difference that's going to make. I think there's another question for you there. And so I'll give you just a quick example of how I saw that translated during the height of the pandemic in the winter. We've always had wish lists on our website, and people traditionally would buy things and actually bring them into the shelter, and they couldn't do that. So we were thinking, okay, we have needs. There are people at home who are feeling desperate. They want to help. How can we make that connection? So we pushed out an upgraded, if you will, Amazon wish list. And I kid you not, when I came into the office every day, outside of my door was this mountain of packages. And so people were finding a way to send us diapers and baby wipes and food and medicine, over-the-counter medicines, all the kinds of things that we needed in a safe way. And so I think it's just continuing to be creative in the way that we reach out to people, being really clear about what our needs are. I mean, make no mistake, for Crossroads House to operate even outside of a pandemic, we need to raise over $1 million every year, just from fundraising. Pandemic aside, that's a huge lift for us, and we spend a lot of time and energy on that. But now we're thinking, how do we do that differently? So I'll let Lauren chime in if you want to add anything.
Thank you, Martha. Lauren, we have a question for you. How have you seen childcare and after-school programs pivot to meet the needs of working women? Is that happening?
I haven't seen specific pivots for working women. I'm sorry, I don't have specifics about that. I've just seen the incredible resiliency of both of those kinds of programs. Child care centers were closed, as were many, many other programs, and weren't allowed to reopen until June 1st. And were only allowed to reopen with very different protocols around space and ratios. And you take an already strained workforce of childcare workers making very little hourly wages and thinking hard about how to keep those little ones in their classrooms safe, while also knowing that many of the kids that were enrolled weren't going to be able to come back. What I'm hearing is 50 to 60% of the enrollment is happening now in both those kinds of programs. So we know there's a lot of stress and strain on the workforce, worrying about those families that aren't coming back, as well as the families that had to make that tough decision. Are we ready? How do we balance safety and coverage so that we can work?
Great, thank you. Lauren, this was for you, but I think, Martha, in your view as well. Many people in our community are isolated right now, very isolated. Who do you know who is doing innovative work on this as isolation increases?
Mm-hmm. So the first partner that comes to mind is St. Vincent de Paul. I had heard from Molly Zerillo, the director there, who said that one of the ways they creatively responded was, although their pantry hours had been structured before the pandemic where folks could visit once a week, they expanded that and said you can visit more than once a week, which is significant. But those that were isolated needed more than that. And they quickly arranged a delivery program and were able to focus on patrons that really could use that support but couldn't get there. So that's one shining story that I remember.
Great. Martha?
I'll leave it at that. That's great.
Great. Thank you. A big, heady question. We've learned a lot about upstream inequities that are contributing to pandemic vulnerability. If Seacoast Women's Giving Circle were to address upstream inequities, help us understand what those funding opportunities would be. Very heady question in the middle of a pandemic.
Well, while you're thinking, Lauren, I'll just say that, I think that it's certainly been an interesting time where a lot of people are thinking about inequities even outside of the pandemic, right? Just like, the analogy of the storm and same storm, different boat, right? And certainly in my work, what I see is that, the example is remote learning. So millions of people across the country are faced with, how do I continue to work at home and educate my kids and do this? For me, I then take it one more step and look through the lens of the people that we're serving who are medically vulnerable, dealing with severe trauma, living in a homeless shelter, trying to figure out how they're going to meet their most basic needs in life, a place to sleep, where do you get your next meal? And on top of that, you're having to deal with these new challenges from the pandemic. So I think as the Seacoast Women's Giving Circle thinks about how to meet some of these critical needs in the community, to really look, from my perch, on a scale of vulnerability, right? And who, where can you have the greatest impact, and where that funding can really, truly make a difference. And so you had so many wonderful guest speakers tonight, and there's so much good work going on in our community. And I think I'll leave a little time. I know we're getting close. I want to let Lauren weigh in on this as well.
Thank you. Thanks, Martha.
So I do think that one of the best approaches to upstream prevention is early childhood and family support. And so anything, just like Martha mentioned, related to trauma, which I think was a previous topic of your giving circle. So you are well versed on that topic. I really do think we can do better in terms of funding support and capacity building around the nonprofits who are working in a whole family approach, in a 2-generational approach, wanting to support parents and caregivers who have scored several points on their ACEs, their Adverse Childhood Experiences assessment, and want better for their children. And so those are the kinds of programs that I think of when you ask about upstream prevention.
Thank you. I'm going to stop us there. We have a lot to take in, my friends at the Seacoast Women's Giving Circle. We've had so many wonderful speakers. We all are going to get off the stage and turn the evening back over to Karen and Heidi.
Thank you so much.
Thank you.
Thank you to our wonderful speakers tonight for your time and your commitment in helping to make this evening really successful. We'd like to thank Kirsten Dersey, Gather, Haven, Lamprey Healthcare, Seacoast Mental Health, Steve Zadravec and George Shea, and to 3S Art Space for your pre-recorded segments. Those were so great to have tonight with us here on this program. Thank you all for tuning in this evening. We hope you found the program to be worthwhile and enlightening. And a reminder to our members, if you'd like to make your annual donation tonight, you can head over to our website at seacoastwomengive.org.
And if you're not a member of the Giving Circle, but are interested in it, you can find that information on our website as well. Thank you again to 3S Art Space for hosting us this evening. We are so grateful. Thank you to Mary Omberg from our events team who worked with 3S to manage all the technical details of tonight's program, and to Allie Bitter from our communications committee who provided the professional photography you saw during the opening slideshow. We also want to give a very special thanks to Jody Walensky-Hill for moderating our evening program. As Heidi mentioned, we encourage you to head over to the Giving Circle website to make your donation. We heard stories tonight of the increased needs during this unprecedented time, and we have a unique opportunity to help strengthen and make an impact on our community. As an entirely volunteer organization, the Seacoast Women's Giving Circle appreciates the generosity of Rick Wallace at Piscataqua Savings Bank, who covers our operating costs. If you're tuning in tonight, you're someone who cares about making a difference through giving. But imagine if your gift is combined with hundreds of others who are also giving tonight. This is the power of collective giving. And 100% of what you give goes directly to nonprofits in the community. Let's rise up and dig deep and make a difference. This year, we hope to direct $100,000 into our community that has shown it is resilient. Please visit our website, and thank you for your generosity. Good night, everyone.
And I'll rise like the day. silence isn't quiet, and it feels like it's getting hard to breathe. And I know you feel like dying, but I promise we'll take the world to its feet. Move mountains, bring it to its feet. Move mountains, and I'll rise up, I'll rise like the day. I'll rise up, I'll rise unafraid. I'll rise up, and I do it 1,000 times again. For that we have each other, and we will rise, we will rise, we will rise, we'll rise. I'll rise up, rise like the day. I'll rise up in spite of the ache. I will rise 1,000 times again, and we'll